Proper insulin injection technique is critical to managing your diabetes. This short demonstration covers the basics of insulin injection. However, if your doctor has suggested a different method, always follow your doctor's directions. In this demonstration, we'll be working with a 1 cc syringe and a 53-unit insulin dose. This is only an example. Be sure to check with your doctor to determine the syringe and the dose that are right for you. When you're ready to inject insulin, you should have all of your supplies ready. These will include your syringe, your bottle of insulin, 2 alcohol swabs, and a sharps container for disposing of the syringe. After washing your hands with soap and water, lay out the supplies on a flat surface. Then, open the alcohol swabs and place them on top of the packages so they're ready when you need them. These are the parts of the syringe. The largest part, called the barrel, has markings on the outside to measure the amount of insulin. On a 1 cc barrel, there are lines marked with a number for every 10 units. Between these 10-unit lines are shorter lines. Each short line indicates 2 units. The barrel has wings on the bottom. On one end of the syringe is a plunger which is covered by a white sterility cap. When this cap is taken off, you can push and pull the plunger to draw up and then inject insulin. At the end of the plunger, there's a black rubber stopper that moves as you push or pull the plunger. At the other end of the syringe is the needle, which is covered with an orange cap. Make sure that your syringe has an orange cap and black numbers on the barrel. If it doesn't, it's not designed for your insulin. Unless your doctor tells you otherwise, only use an insulin syringe. If you're using a new bottle of insulin, pull the plastic cap from the top of the bottle and throw it away. On the label, write the date that you opened the bottle. That way you'll know when a month has gone by and it's time to dispose of the insulin. Check the insulin closely. If it has any lumps or crystals or a strange color, dispose of the insulin and use a new bottle. If you're using clear insulin and it looks okay, then you're ready to begin. If you're using cloudy insulin and it looks okay, gently roll the bottle between your hands about 20 times until the liquid is well mixed and has an even look. Never shake your insulin. You'll create air bubbles that could make it hard to draw it into the syringe. Shaking could even damage the insulin. Use one of the alcohol swabs to wipe the top of the insulin bottle. When you draw insulin, the first step is to inject air into the bottle. To get started, gently twist and remove the sterility cap from the plunger. Then, pull the cap off the needle. Be sure to pull it straight off to avoid damaging the needle. Injecting air into the bottle will make it easier to draw the insulin. The amount of air you inject into the bottle is equal to the number of units of insulin that you intend to take from the bottle. Gently pull the plunger down until the end of the black rubber stopper is even with the line indicating your dose. The end of the stopper is the part closest to the needle end of the syringe. Be careful not to pull the plunger too hard. It could come all the way out of the syringe. In this demonstration, we'll draw 53 units of insulin, so we'll inject 53 units of air into the bottle. To get 53 units of air into the barrel, pull the plunger to make the stopper go down the barrel past 40 units, past 50 units, and past one of the small lines. Stop halfway between the first line, which shows 2 units, and the second line, which shows 4 units. We now have 53 units of air in the syringe. And remember, we'll do exactly the same thing when we draw the insulin. Once you've drawn air into the syringe, take it in your hand like a pencil. Hold the insulin bottle on a flat surface with your other hand. Place the needle's point at the center of the bottle's rubber top. Avoid touching the metal rim on the bottle with the tip of the needle. Holding the syringe straight, gently push the needle through the top of the bottle until the entire needle goes in. Then, slowly push the plunger. As you do, the air in the syringe goes into the insulin bottle. Now, turn both the insulin bottle and the syringe upside down so the bottle is on top of the syringe. Make sure the needle is below the level of insulin left in the bottle. You may need to pull the needle out a bit. To draw insulin into the syringe, hold the bottle and slowly pull down on the plunger. Push up on the underside of the wing with your index finger and use your thumb and middle finger to pull the plunger down. Pull down on the plunger slowly and steadily until the end of the black rubber stopper is even with the place on the syringe indicating your dose, in this case, 53 units. It's important to pull slowly because pulling too fast will bring tiny air bubbles into the syringe. Before you take the needle out of the bottle, look at the syringe to see if there are any air bubbles. Air bubbles take the place of insulin in the syringe, which keeps you from getting your full dose. If there are air bubbles in your syringe, slowly push the plunger until all of the clear insulin is back in the bottle. Then redraw the insulin more slowly, again checking for air bubbles as you go. Repeat these steps until there are no air bubbles in your syringe. After you've drawn up an insulin dose without air bubbles, turn the syringe and the bottle back over and place the bottle on a flat surface. Holding the syringe by the barrel, carefully pull the needle out of the bottle. Place the syringe on the table, being careful to not let the needle touch the surface. Now, with the second alcohol swab you opened earlier, clean a small area of skin where you plan to give yourself the insulin injection. Start in the middle of the area and then, moving in a circular motion, clean the whole area. To reduce any stinging, be sure the alcohol in your skin is completely dry before you inject. Next, gently pinch up the area of skin that you cleaned with the alcohol swab between your thumb and other fingers. Don't pinch too tightly. Position the syringe with the needle near your skin at a 90-degree angle. If you're very thin, you might need to inject at a 45-degree angle, but if you're not sure, discuss it with your healthcare professional. When you're ready, push the needle through the skin into the layer of fat just under your skin. Move your index finger to the plunger and slowly push it in to send the insulin into your body. Release your skin after you inject. Slowly count to 5 before gently pulling the needle out of your skin. It is important that the needle not be removed too quickly to prevent leakage. Press an alcohol swab over the spot where you injected yourself. To finish up, properly dispose of your used equipment. Put the used syringe in a sharps container, which you can buy at your local drugstore. Place the syringe caps and alcohol swabs in the garbage. Be sure to check with your local sanitation department regarding its rules about proper disposal of used syringes and sharps containers. And remember, you should always dispose of your syringe and needles after you've injected. Never reuse them. For more information on how to properly dispose of your insulin injection supplies, visit the needle disposal page in our website.